think it really helps when community members are coming from an evidence-based approach, so they really understand the issues that they've faced in their community. They've done it based on their research. The policymakers pay attention to that intel into what's going on in the community.
I would feel most listened to if people actually did something about what I'm saying, and everyone's asking the same questions, yet nothing is being done about it.
And having it far more place-based, so from that bottom-up approach, really listening to what's essential in those places and those with the lived experience.
So we believe it should look accessible, inclusive and meaningful. Decision makers should try and make a conscious effort to reach seldom heard groups and those who may struggle to get the right across.
What we need to do is hear a diversity of different voices and experiences and challenge some of the perceptions that we have as people that can make decisions and have power. And we also need to consider some of the things that are inherent in the system that really create a power dynamic. We need to consider things like equity, what we can do to raise up voices that are more difficult to hear.
The new dementia strategy was shaped by a panel of people with lived experience, and when we saw the actual strategy, it was all reflected in there, so they really listened. And I think that was because we were a community of people that were prepared to talk about the questions that the government were looking to ask. I do think we are beginning to see real traction on that front.